Welcome to Soundbite, the podcast where we talk to interesting people in the Maritimes about their stories and current issues. I'm Caitlin Dutt, one of your co-hosts.
And I'm Tim Porter. Okay, we're back.
We are back.
Summer's rolling right along, Caitlin.
It's already August. Crazy.
You've already had your vacation.
Yeah, all my vacation time is used up until the Christmas break,
right.
So I'm ready, back at it.
Great. You were in Montreal.
I was in Montreal, yeah.
That go well?
It did go well. I was able to see a couple of great artists. I was very happy. Olivia Rodrigo, Glass Animals.
Right.
Yeah, it was a great time.
All right.
Yeah. Did you have any fun things happen over your August-long weekend?
No, I worked, but I'm going next week, so
okay.
Yeah, we'll see.
We'll have to update later.
Yeah.
On the adventures of Tim Porter.
Yes. I've got a Steely Dan song in my head from the radio this morning.
Okay.
Yeah. Hey 19, do you know that one?
No, I do not.
Ricky, don't lose that number. You have no idea what I'm talking
about. No. Well, that's okay.
Maybe our guest knows because she's kind of a local celebrity.
Yes, kind of. Super excited. We have Dr. Jennifer Russell on our podcast. Oh, my goodness. Welcome.
Right.
Thank you. I'm very grateful to be invited here today. Thank you for having me.
And how do we know Dr. Russell? How do we know?
There are many ways that we know Dr. Jennifer Russell. We'll start with, she was the former chief medical officer of health of New Brunswick during what some may know as the COVID-19 pandemic.
Oh, yes, I remember that.
Yeah, I feel like it's all just a blur in my memory.
Right.
I had to go back into news articles when I was doing research for this and be like, oh yeah, that's right, the 4 waves. And I'm sure you as well have tried to erase that period of time from your memory like we all have.
It was a challenging time for a lot of people, yeah.
You were the person up there with our best friend Bruce McFarlane.
Yes.
Right?
I adore Bruce. Oh my gosh. Bruce and I spent a lot of time together during the pandemic for sure. Yeah.
I bet.
He was my right-hand person in terms of, the notes, the prep, the everything, the coffee,
Yeah, you became like a lot. I feel like we had all developed a little bit of like a parasocial relationship with you through our YouTube screens. All of those like YouTube briefings, and like you became New Brunswick's like guide through the pandemic. I feel like.
Well, people do come up to me now even and say that they felt like they knew me, that they felt like I was part of their family almost. They really trusted me, and it was really reassuring to hear from me, and that was part of their daily routine.
Yeah.
So I don't know, when you sign in as public health, and I've worked with kind of a few of your predecessors before, but when you sign in, do you actually expect for something to go wrong at that level, or are you expecting maybe a little easier ride, or
I feel like one of those Monty Python movie quotes, nobody expects the Spanish Inquisition.
Right.
Nobody expected the COVID-19 pandemic. I think the nature of public health is to prepare for emergencies.
Sure.
So whether it's an outbreak, whether it's a chemical explosion, whether it's, a wildfire, or a nuclear disaster, we're trained to prepare for any and every type of disaster, small scale, big scale. And I think what was forecast to be prepared for for a mock exercise was in April of 2020. We were supposed to do an H1N1 mock exercise.
Yes.
Fun.
So that was on the docket. That was on the work plan.
Yeah, I worked on that when it first kind of came around years ago, so those and SARS and that sort of thing, but it never really hit quite as bad here early on in those cases. But I remember we were always saying, prepare for the bird flu. And I was kind of like, oh, yeah, well, we'll see if the bird flu ever comes.
Yeah.
Like, I don't know.
You never expect it.
Yeah, but now, I mean, bird flu is kind of a thing, right? Like down in the States.
Yeah, that's true.
Yeah. So you never know what's going to happen in the world. So you started out, though, as a medical doctor with the military, did you not?
Yes, I did.
Yeah?
Yes, I joined the military in 1996. It was my second year of medical school. The year before, they had actually closed the medical officer training program, and then they reopened it in 1996. So I joined in my second year med school.
Right.
Oh, okay. And how was that? Do you feel like that prepared you for what was going to be the COVID-19 pandemic all those years later?
Absolutely. I mean, obviously, you join the military. You're signing your life away. That is the deal. You sign a piece of paper that says you are committing to this, and you know, whether there was a war in Bosnia, whether it was war in Afghanistan, those were the types of things that would have been on my mind, you know, as I went through my training. In fact, I went to basic training the same week that 9/11 happened.
Oh, my goodness.
So I was actually in the basement of the National Defense Headquarters in Ottawa getting all of my gear issued to me, and that was the Tuesday, and I was leaving for Saint Jean, Quebec on the Friday. And when the first plane hit, I had, you know, a few articles on the counter, and when the second plane hit, they closed the building. They sealed it. They said, you'll have to come back another day.
Yeah, wow.
Yeah, I remember watching that on TV. You're probably too young, Caitlin.
A little bit.
But definitely the discipline and the routine and the being able to work very well under pressure. Definitely those skills were definitely instilled in me in the military. Even the battle rhythm. We had what we called a war room. So Bruce would have been very familiar with. I think it was called 3Z. It was on the third floor in the health building, and there were about 40 people there every day in their desks, and we had, you know, all the in briefings and out briefings every hour or so.
Right.
Yeah. So it was very much like the military in terms of the routine.
Right. And did you go right from the military to working in government, or?
No, actually, I took a little detour. When I finished my work in the military, I knew that I wanted to do something in the civilian world, whether it was family medicine or something like that, because the military medicine was more occupational medicine, and it was not really family medicine in the sense that you're not dealing with families. You're dealing with soldiers who are mostly male, mostly from the age of 18 to 55. So to get a wider breadth of medicine, I really want to do more clinical work in as a hospitalist, doing locums for family doctors, and I also worked in mental health and addictions for about 6 years. So by the time I joined the team at the Department of Health as deputy chief in 2014, I had a great clinical career. So I was ready for a different environment.
Yeah. And now you're doing something else.
Yes, I'm in academia here at UNB. It's amazing. What a transition. And just before we started the recording, I was reminiscing about my time here as a student. So it's really been amazing to be back on campus in this new role. But back when I was a student here doing my science degree, I mean, I spent most of my time in Bailey Hall, but as I mentioned, I did pick up my saxophone while I was here, and I played in the concert band, and I played with Richard Hornsby in a saxophone quartet, and I had a little radio show, a classical music radio show, but I don't think anybody listened to it, because I used to try to give away tickets to the Playhouse shows, and I'd play a song, and I'd say, you know, somebody can tell me which composer this is, then you've got these free tickets to, but nobody called in.
Right.
Oh, sure.
Yeah.
Well, now you're bringing in bigger numbers with, you know, the Jen Russell Big Band, and you're part of the Tortoise Hare and the Millionaire, if I'm...
I used to be before the pandemic. My goodness. So I started playing piano when I was 9, joined a choir. Then I started playing saxophone when I was 13 because of a school program that started. And so it was basically free saxophone lessons and playing in a concert band and a jazz band at the age of 13. And I remember the first time that I heard a Glenn Miller song, we had to play In the Mood. And I was like, what is this? I've never heard this before. And I started to get really interested in big band style music. So fast forward to, you know, the 2000s here in Fredericton, I joined a band called Vinyl to Bits with Mike Mallory and John Keddy. And then they said, you know, we really want to play at Harvest. And I don't think we're going to be able to play at Harvest if we don't have some original tunes. And they knew I had written some songs. So they said, Jen, you can write some songs for us. And at that time, we were playing a lot of swings. We were playing a lot of Colin James and Brian Setzer. And so it felt very natural to start writing some in that style. So I wrote about 3 songs, recorded them, and then recorded 7 more, wrote 7 more, recorded those, and then so launched the first CD in 2014, and then launched the second CD in 2019, which was a fundraiser for Liberty Lane here in Fredericton, which is second stage housing for women and children who are victims of domestic violence. So that's how my saxophone career kind of got going, and my songwriting career. So then I ended up playing in my own band, the Jen Russell Band, and have 2 CDs on Spotify, and I think I've made a total of $70 from.
Yeah.
Hey, that's pretty good. Better than nothing.
And the Tortoise, the Hare, and the Millionaire. Oh my goodness, I love that band. So they are a funk band. They play some cover tunes and some original music, and they approached me twice to play in their band. And the first time I thought, why are you asking me to play in your band? There's so many great saxophone players in Fredericton. Anyway, so the first time they asked me, I said no, and then they approached me again in 2019, and I did say yes, but I kind of had to audition.
Okay.
And they said, okay, well, there's these 3 tunes we're going to play, and here are the charts. And I looked at the charts, and you saw me a while ago playing music with my saxophone and looking at the notes, and there were no notes. It was like, there's no notes on the chart.
Oh, my goodness.
They said, yeah, you're just going to improv. I'm like, oh, right, okay. I have done that before, but it's been a while.
Yeah.
So at this rehearsal, which was an audition, I did some improv for the first time in years and years and years and years. And anyway, they said, yep, we want you to play. And so that was June of maybe April of 2019. And then I played all sorts of rehearsals with them. And that summer, we played so many gigs. We went to St. John, PEI, Perth, Andover. I don't know where we went. And then we ended up playing at Harvest in 2019. In September, we opened up for Nathaniel Ratcliffe in the Big Blues Tent. And that was the pinnacle, the highlight of my saxophone career. There's still videos of it, and I watch them. I'm like, yes, that was awesome.
Oh, man, that's awesome.
That's great.
And then the pandemic hit. 7 months-ish later.
Yeah.
Oh, well. And so that must have been like when I feel like all of us kind of remember where we were when the pandemic kind of like happened, March, what was it, 11th, I think, 13th-ish. Where were you when, the World Health Organization announced it's a global pandemic?
So we sort of had an inkling earlier than that. So at the Department of Health and with the Public Health Agency of Canada and all of our counterparts across the country, the Chief Medical Officers of Health across the country, we started meeting as public health teams probably in late December, early January to sort of formulate a little bit ahead of time like how we would be approaching a little bit. But even then, I remember hearing early on, like, well, this is just going to last for 3 to 6 months.
Right.
Yeah.
And wow, that was so wrong. But again, you were dealing with things that were happening in real time, and so you were writing kind of the things that needed to happen as the information was coming, and as soon as you got new information, sometimes it was outdated. I remember going to work in the morning at 7 or 7:30, coming home at 9 or 10 at night, and then reading more things between then and when I went to sleep, and getting up in the morning and like more things had changed.
Yeah.
So it was an ever evolving, so fast paced in terms of the information that was coming in. And I remember looking at the Johns Hopkins website, and the numbers were changing. It had that global map in red and the black background, and the numbers were changing. Like, oh my gosh. So I think for my personal life, I think when it impacted my family and my kids in terms of their schooling and whatnot, I think for them, obviously anybody with kids in school at that time, I think that's when everything kind of changed.
Yeah, I was in the Caribbean, and you kind of knew in March that things were happening because you kind of in February you kind of got that feeling, and the day we flew back was the day that you had shut down the schools, and my son couldn't go to school and that sort of thing. But I guess kind of the question there is, was it difficult to get the attention of the government in terms of that shutdown? And like, did you have to plead your case? Like, because it was a pretty aggressive move to just shut everything down.
Well, I think at any time during the pandemic, what was clear was that there was a great amount of cooperation from all the government departments and cabinet, and then as you saw between the different government parties in the province. So I think that early conversations, that early, I think it was just, again, so much information coming so quickly, and then trying to make those good decisions early on, and people can look back and say, well, it was a good thing or it wasn't a good thing, and everybody can second guess after the fact. But I think we took the information we had at the time as a government, and people would say, well, what did you say, Dr. Russell? What was your opinion on that? We make decisions behind closed doors. It's cabinet that decides, and whether cabinet takes the advice of whoever's giving that advice or not, that's really what democracy is. Democracy is the government makes the decision because they are the elected officials. And I remember that conversation was really hard to have with people, especially if there were different things happening across the country with different governments and different policies. So if we were all basing our decisions on the same science, people would say, well, how is it possible that this province has a different way of approaching it and this province has a different way of approaching it? But again, it all comes down to, what does your population look like? I mean, New Brunswick had an elderly population. It still does. We have a population that has a lot of people at risk with respect to their immune systems, whether it's chronic diseases, et cetera. So I think every population had to make a decision on its own with respect to how they were going to deal with that information.
Yeah, I think everyone was very happy with the shutdown in terms of New Brunswick seemed to be a little bit ahead of the curve on that. I think where people got a little questioning was more in the reopening and how that all occurred, and there was a few places where we reopened and then shut down again and that sort of thing. And I think that frustration sat in, and I don't even know how long a period of time that was. I guess it was over a year or two kind of thing.
Yeah, I think it was like 2 years.
Yeah, it was interesting. I think one of the biggest things here in this province anyway that I have to say, was very impressive was the amount of trust and faith that the population put into our approach, as well as their comfort level with cooperating and complying with whatever direction we were giving. And a sense of altruism has to be there for that many people collectively to do the right thing at the right time.
Right.
And so I have a great sense of pride. Being a New Brunswicker, I'm from Bathurst. I have a lot of pride in how New Brunswickers stepped up. I feel like at that time there was definitely a great sense of New Brunswick unity.
Yeah.
And so as this pandemic was unfolding, I was looking back at the timeline of everything, and, you had put up like a mask mandate, and then you had kind of taken it back and then kind of put it back up again. And there was a couple of times where things were like, you could kind of tell that the gears of like government were kind of turning and figuring out how to best like protect the population. But how did you manage the balance between like the normal operations of society and maintaining that and like protecting people, because that's a difficult balance?
Yeah, exactly. And I think that's the other, I'm working now at the Institute of Population Health at UNB, and I have a communications officer who's here today, Dominic Burke, and we talk a lot about the knowledge translation of public health and population health and what does it mean. And really it's about the social determinants of health and all the things that make a person healthy, not just healthcare in terms of health services. And that, to communicate those messages, is really challenging sometimes. And even during the pandemic, when we knew that, yes, we're going to have an all-of-government approach. We're going to have every government department, which almost is like social determinants of health. And, okay, social development is one government department that has implications, in Department of Education, et cetera. So it's interesting, the parallels between every government department having inputs, not just by themselves, but also their interactions with all of their respective stakeholders. And I think watching that unfold was really, really eye-opening and interesting, because the relationships that were built before this crisis, which are really important in a crisis situation, because having those relationships built ahead of time with stakeholders and whatnot, to see the fanning out of the information, to receive the information coming back, and that feedback loop in real time was really impressive. And in terms of the work that I'm doing now at the Institute of Population Health, those lessons learned of, wow, when the government or when society wants to solve one problem together, it can be done. And when we watched it being done in real time.
Yeah. And I guess we have different examples from Canada and the United States, kind of different approaches. And, I don't know. The states seem to go kind of more into the herd immunity kind of area.
Yeah, and there
much
was
more.
countries in Europe as well, and I
Right.
think when we talked about where were you early on and what were you doing, I remember seeing the video clips of places like Italy and New York and those morgue
Yeah.
trucks and
That was
the
bad in Italy, yeah.
the military, like that visualization of some of that tragedy was very jarring, and definitely I think made me certainly have a heightened sense of, wow, we don't want this to happen here.
So many people died
Yeah.
very quickly.
Mhm.
Yeah, it was.
For sure. And what you said about like the New Brunswick having like an elderly population, I feel like that would like impact us quite a bit as well.
And coming back to the balanced approach with all of government, knowing that whatever approaches, there was actually a stringency scale. So whatever measures you put in place, whether it was masking or distancing or whatever, or a lockdown, each of those things had an equation with it or a number associated with it of the degree of stringency. And with each harsher and harsher measure that was decided upon in any place around the country or around the globe, there was an associated, let's say, risk or negative impact or unintended consequences that would go along with each one of those. And so obviously the stricter the measures, the stringency component was a factor. So it was always considered. And those negative impacts and unintended consequences, we're still feeling the effects of those today. When you think about some of the mental health effects that happened for some children at different stages of development, depending on where they, at what age they were when the pandemic struck. So I think maybe economically, there are parts of the economy that might not have bounced back as quickly. And even some of the socialization comfort level, like I think my parents didn't socialize in a group for years after, at least months, So undoing some of the things that happened as a result of all the different measures and decisions that were taken at the time, we're still probably going to feel those effects for a bit.
I never really got the mask anxiety. I mean, I know it was kind of a foreign concept. Maybe just before the pandemic, you'd see it occasionally on planes or something. Somebody with a chronic issue might have a mask on, but I mean, basically, it's a piece of paper over your face. I mean, that's not that big a deal. And I think we've kind of broken down that barrier now. I mean, it's people are if they want, they do wear masks. I see it like in Costco and various places. So we've kind of broken that down a bit, and I think that's good.
I think like even if you're still sick, like it's just kind of like a nice thing to do so other people don't get sick, at this point.
So that's a positive.
Yeah, that's a positive. But you made like so many recommendations during like this like probably 2-3 year span, but would you have done anything differently now looking back with like 5 years?
I don't think that I would do very much differently, only because it was the process behind how things worked, what the public saw and heard in terms of the messaging was the process behind that was, I felt, quite balanced and quite important in terms of how the data was used, the modeling that was done. We actually had modeling for COVID numbers that was done here at UNB with mathematicians alongside our epidemiology team at the Department of Health. And so working together with the data, with the numbers, and what those impacts were going to be, again, at the cabinet table, hearing about, well, there could be this consequence if we do this thing this way. There could be this consequence. And so which consequences are we going to be able to manage? Which things are the public going to be able to accept? And so there was a balancing around how the decisions were made. So I think the process was the right process. So I think that's what gave the outcomes and gave the direction.
So what's your objectives now at UNB?
Well, I think the fact that the reason I went into public health in the first place in 2014 was because as a clinician, I kept seeing the people with chronic diseases who were all on a certain number of medications. And I really felt, and even with the work that I was doing in mental health and addictions, I really felt like, wow, what can be done and what should be done with respect to prevention upstream? Right. And is everything being done that could be being done upstream in terms of prevention? So that's really why I went into public health. And in public health, you're putting out a lot of fires. I mean, I think when I walked through the door, I think 3 weeks later, West Africa and Ebola was really a big a situation. And so that was one of the big things at the time, because then we had to, have our processes in place for screening and what were we going to do here in New Brunswick. And then, I think after that it was Zika virus. And then we've had an increase in tick-borne illnesses and. So there's always the fires to put out. And so the background work of health promotion and health protection and prevention, I think it's a priority, but it's not the front and center priority that I get to focus on now at the Institute of Population Health. So now I get to focus on research that's focused on better population health outcomes, as well as translating research that's either done here or elsewhere into action. And can we look at our population health outcomes in terms of what's being done here, what is done elsewhere? Certainly during the pandemic, we borrowed policies from other countries and we would New Brunswickize them. Yeah. And so are there things that we can gain from other countries who have really who've tackled population health and well-being outcomes in a different way that has a different kind of approach? So places like Australia, New Zealand, Scotland, Wales, and Finland actually have frameworks that have budget and accountability tied to well-being and population health outcomes. And so in those situations, you can see that it's kind of like an all-of-government approach, because every government department would have their mandate, their resources, and their way of approaching whatever policy and legislation they needed to put into place to help with population health outcomes. Here in Canada and here in New Brunswick, we have a problem with our healthcare system being very stretched and strained. And so access to care right now is what people are most interested in and most concerned about. And when you think about 170,000 people or 180,000 people in New Brunswick not having access to a family physician, that's huge. When we look at access to care and we look at trying to help with the healthcare system and trying to fill those gaps and change the way we can provide access to care, if you take that 20,000-foot view, step back into the upstream prevention, can we also concurrently do this other type of work so that we can take pressure off the healthcare system by putting into place policy and legislation that can help with population health outcomes? Yeah,
and that's something that's pretty critical for New Brunswick, especially as our healthcare system is struggling a little bit lately. Yeah.
So what are the big risks facing New Brunswickers now?
Well, I think the risks haven't changed a whole lot in the last several years. I think the pandemic has exacerbated some things that were already challenging, whether it was, the cost of living and housing and affordability. When we look at the social determinants of health and the socioeconomic status of people in the province, I was speaking to another group earlier today around, when I was growing up, we used to hear about New Brunswick being called a have-not province. And I was asking myself the question, is New Brunswick still considered a have-not province? So I was looking at the socioeconomic data and thinking, I think we still have some challenges with poverty, with education, and how can we look at some of those things and really take those into account when we're looking at the overall health of the population, the overall needs of the healthcare system in terms of access, and how is that impacting productivity in the workplace for industry and businesses? Because that ultimately is what's contributing to our GDP. And if we really want to be a prosperous province, all the things that contribute to that along the way really should be looked at. So I think we have many challenges. I think we have opportunities to look at those challenges in a different way, and so I'm very optimistic and hopeful and very energized about what things we can accomplish.
Yeah. Well, that's awesome. I think that's all the time we have for our radio guest today. So,
but Dr. Russell has agreed.
Yes.
To play us out on radio.
Yes, exactly.
And we're going to come back, though, for a little bit of overtime.
Yep.
So we'll have a bit of an interlude on our podcast.
Exactly.
So thank you, Dr. Russell, and we'll be back on overtime in just a
minute or two.
Thank you, Tim. Thank you, Caitlin.
Bye. Bye.
Okay, we're back. And Caitlin, there was a couple of issues you wanted to explore with Dr. Russell.
I guess just a couple of questions.
We're here with Jen Russell.
Might as well while she's here
Yeah.
with all of her knowledge. But I'm sure you've heard of this. Measles has recently popped up again, specifically in New Brunswick, somewhat in Alberta, somewhat all across Canada and the United States.
Down in the States,
Yeah. It's unfortunate. I mean, we do have a vaccine for measles, as our viewers or listeners are aware of. And I do wonder, though, following the pandemic, there seems to have been quite an increase in vaccine hesitancy and all of these fears around this. Do you think that exists in New Brunswick?
So before the pandemic, I think with respect to vaccination and immunization rates in the province, the public health department would always have an eye on that and have a plan and a strategy to work towards making sure our rates were as high as they could be. And during the pandemic, with the rise in kind of anti-science and misinformation and disinformation, which continues today, it's quite prevalent in North America. It's prevalent in Canada and New Brunswick. I think we're living with this as part of a hangover from the pandemic right now. So the bad news is we're seeing outbreaks of measles, and we're seeing it really negatively impacting people's health. I think, again, coming from the Institute of Population Health here at UNB, I have the great honor and privilege to be able to be part of some of the solutions for this. So I get to work with people like Research NB and Candace Pollock, and we've just had some conversations around hosting an Atlantic Canadian event to help counteract misinformation and disinformation, not necessarily in terms of what we knew before the pandemic, but what we've known and learned since then around misinformation and disinformation, and what the specifics are of it, and what could the potential opportunities for addressing it be.
Mm-hmm. So what are some potential ways of addressing it?
Well, I think understanding, again, why it's happening, where it's coming from, and where it's being directed. So obviously there's a certain part of the population that, and this is true of any really big polarizing issue, you have a certain percent of the population who are for a certain issue and some people are against, and then there's the people in the middle who haven't decided, or they need some nudging or some whatever in either direction. So I think thinking about what it is that is missing from the approaches right now for that population, I think will take some digging into. Knowing that before the pandemic, the evidence was around, who are the most trusted people in a person's life with respect to health, and that's doctors and nurses. And so we knew before the pandemic that if you were going to receive information about vaccinations, it would be from a doctor or a nurse, in terms of that's what you would receive and feel confident and trust. But the landscape has changed. Again, we've talked about access to care and how so many people don't have access to a family doctor. And so I think the approach in the last several years to change sort of the approach to primary care and expanding, let's say, the roles of pharmacists and other caregivers. So where else are people getting access to information, and how is the messaging presented? How is it being received? And are there things that need to change based on that?
Yeah, I think people have to kind of keep track themselves, because if they don't have a family doctor or sometimes it's hard to remember, particularly in some of these ones that you'd only get every 10 years or whatever it is, sometimes you kind of forget whether you've done it or not. But and even the ones that you get more regularly, like the COVID and the flu, I mean, it could be better communicated as to when you should receive those and where you receive those. Like, I know, I've gone to pharmacies too late. Like, they say, oh, well, we ran out of that last month, or something like that, So I think just maybe if we had a little bit more marketing or something that would let us know when things are occurring a little bit more would be good.
Of course, and some of the approaches that we're going to take in our discussions in that event, it's going to be in November, will involve communications and marketing and promotion in terms of what is the right message, right time, right place for the right audience. It's really important. I think the other thing about vaccinations is, there was a corporate knowledge that was held by a certain percentage of the population who were of a certain age. So they would have remembered family members or themselves being affected by certain vaccine-preventable illnesses.
Right.
And as the population ages, as time goes on, you lose that corporate knowledge or that corporate memory of some of those issues.
Yeah, for sure. Yeah.
Just looking at like a stat here, like some of the most recent numbers from 2023 to 2024 show that at least 10% of children in New Brunswick were not vaccinated for measles, mumps, and German measles. I don't know if that's a variant, but do you think that people should be worried, or like what do you think is the level of caution that people should be taking? What should the public know about this?
So we're going to come back again to knowledge translation. So obviously when it comes to vaccinations and the message around, what we need to protect ourselves, but what do we need to protect our communities? What is the meaning of herd immunity? Why is it that we need not just a certain percentage to get protected themselves, but by virtue of their protection, protecting the overall community? I think that's a really difficult message to transfer. And so then we come back to that altruistic idea that we talked about earlier in the pandemic when people were complying with recommendations. There was a certain sense of altruism. They were making sacrifices in terms of maybe changes in their behavior or what have you for the good of the whole. And so some of the knowledge translation is really difficult around that. But then it's also some of the anti-science and misinformation, disinformation. So there's a few different issues at play. And I think having an event where we get to dissect those things and talk about each one of them separately to see, well, collectively then what needs to be done to address them, I think is going to be really helpful.
Mm-hmm. And so going back to your position at the Institute of Population Health, is there anything in particular that you're excited to be working on at this particular moment?
Well, jumping into academia, having not had any experience other than the training I had as a physician or my background in science or music, learning about research, learning how researchers do their work, how they apply for grants, what kind of teams they work with, what are the skill sets of the people that are part of research teams, and what those outcomes are and how long it takes. So some projects are really long, some projects are shorter. So I'm excited about being here, number one. I'm excited about learning about this process. And then I do have probably 3 or 4 projects that I have been funded for, that the Institute's been funded for. And then I have a few in the hopper that were being discussed right now. And they vary from, some of them have to do with veterans, some of them have to do with First Nations, some of them have to do with modeling. So using the modeling example of COVID, taking a chronic disease risk factor and modeling that to show what if we put policy X into place or policy Y, what would that do to this risk factor? And then what would that be in terms of the impact on that disease? And then what would the impact be on the healthcare system in terms of health service delivery needs? And so Vitalite has done modeling around health service needs between now and 2050. So if we're looking at flattening the COVID curve before, I would like to see how we can flatten the health service needs curve. We see lots of data around, health service delivery and wait times in emergency departments and wait times for hip and knee surgeries. And the New Brunswick Health Council does a great job at making sure that we have this information. And the government across the country respond to this type of information, and we're compared to the national average. But I would really love to see, and I'm grateful to be able to do this kind of work at the population level for chronic diseases like heart disease, cancer, dementia, et cetera. So that's what I'm really most interested in and excited about. But there's such a wide variety of things. It's an exciting time.
Mm-hmm.
So I just wanted to ask you a question. So I'm sure your parents weren't too upset when you said you wanted to become a doctor. But do you think you should have just pursued music?
Oh my gosh!
What do
Oh
you
my
think?
gosh! That's a difficult question. They just wanted me to look. I'm from Bathurst, and my dad worked at the mine, and my mom worked at the paper mill, and education was everything. So for them, making sure that I got a university degree and was able to get a good job and provide for myself and my family, etc., that was their main goal. So if I exceeded their expectations, great. Did they want me to join the military? Probably not. But I think I think it comes back to my grade 12 English teacher, Mr. Merjo, if he's listening. And you know that poem, the road, the path less taken. And so I feel like rising to the occasion, taking these challenges on, you are richer for it. You are in terms of experience, and you are. And my daughter still, she has read that and has the same kind of take on life and philosophy. So she chooses to challenge herself. So I love the fact that all the things that I've done, I get to share these experiences with my kids, and then watch them and the experiences they have now. My son coaches tennis. He's about to hopefully start engineering this fall. And my daughter's just finished her second year at UMB, and she's at a camp this summer. So they're both impacting the next generation based on some of the positive experiences they've had and the challenges that they've risen to. And so, yeah, I don't think my parents are upset where I am now, and I think they're grateful that I've had these opportunities, and I think they're grateful that they set me up for these opportunities, including the fact that I speak French. So being able to deliver all those messages during the pandemic in French and in English, I can only say is as a result of them being able to offer me that learning when I was young.
Yeah.
Well,
So we heard you play saxophone at the break, but you sing as well.
Yes.
Your band, you mainly sing, do you
Yes.
not?
And when this podcast is aired, I will have played at Rustico.
Right.
That show.
Nice.
Yeah.
Alone
Yes.
or?
No,
or,
actually, my band is usually about 8 people. It can be as big as 12, depending
Wow.
on if I have horns and strings or just horns.
Oh.
But the show that will have just taken place when this has aired is going to just be a quartet, and so it'll just be myself singing, Jason Flores on bass, Doreen Hateman on keyboards, and Gary Hansen on guitar.
right. And do you sing your own songs, or
Yes.
do you have
I usually
others?
just sing my own songs, but my keyboard player, Jorian, asked me last night when I walked into my rehearsal, he said, "Hey, are we doing any cover tunes?" And my immediate answer was, "No, we're not doing any cover tunes. We're just playing my originals." And then I stopped and I thought, you know what? I think we are going to do a cover tune. So we actually are, yes, there's one cover tune that we are doing that we will have done.
nice.
Okay.
You want me to tell you what it is?
Well, I mean, is it jazz? Like, is that?
I do
that-
40 style jazz mostly, a little bit
Right.
of blues, but because variety is the spice of life, you'll hear a smattering of styles. So I have one song that's a very Latin sounding song. I have another song that sounds very bluegrass. I have another song that sounds a little bit country. So mostly it's jazz and it's 40 style swing, but there's a smattering of other styles in there.
Okay. And you can build a pretty long set list. Can
I'll
you?
be playing for 2 hours.
Oh, good.
Yeah. Mhm. If I have to play, I have played for the swing dancing club here in Fredericton at the Legion before it was torn down and rebuilt, and they needed me to do a 3-hour set. So that third hour was cover tunes, and it was all swing music.
Right.
Yeah.
So do you take a lot of bookings?
I used to before the pandemic.
Yeah.
Since the pandemic, not so much. I usually play 2 or 3 times a year. Last year, I was
Okay.
invited to play at the Edmundston Jazz Festival. I played here at Harvest Jazz and Blues with my band at the Playhouse. That was probably my favorite show of all. Well, I can't say that. One of my favorite shows with the Jen Russell Band. So yeah, I do get some invitations, but it's not. It's a few times a year.
What do you want it to, build it back up, or what are your thoughts on that?
I think that would be fun. Yeah.
Yeah. All right.
Yeah.
Well, anyone looking to, get some music for their venue, hit up Jen Russell. Do you have, I know that you actually had just put out like an album the year before the pandemic. Do you have any plans for a new album that you're thinking of releasing? Or?
Well, funny you should mention that. I actually had writer's block for about 4 years.
That
5
makes
years.
sense. That makes sense.
And it was really frustrating because I think, I'm sitting at the piano. I want to write some songs. And boy, it was tough. It was really, things were not happening the way I thought they would and could and should. So, but lo and behold, in the last year, writer's block has been dislodged.
Nice.
And so when this podcast is on, I will have aired, then I will have released my first new song since 2019.
Oh, wow.
Yeah,
okay.
we'll say released. First public performance of a brand new song that I just wrote.
Okay,
Yeah.
great. So do you think it'll be going to Spotify soon? Or?
Oh, I don't know when it's going to get recorded. So
Okay.
first public performance will have taken place, but
Right.
I don't know, because I don't know if I'm going to do that, record that and release it, or if I'm going to wait until I have another whole album.
Right.
And normally, from beginning to end, it takes me 5 years to do an album.
Okay.
Yeah.
Well, you got to kind of go nice and easy, kind of figure it all out, make sure it flows all together. Yeah.
Well, I thought I was going to have this pattern. I had one in 2014 and then one in 2019, and then I was going to have one in 2024. But we're off track now. So
That's okay.
we're just pressing the reset button now.
There was a little pandemic blip in there where I feel like 2 years kind of went by and they were 2 years of nothing, So that makes sense. Everyone gets a little bit of a grace period.
Oh, my.
So what's at the top of Jen Russell's Spotify?
What do I listen to?
What are we going to hear in your car if we get in?
Oh my goodness. There's so many different genres, Tim. I can't even tell you. I will say that I just got back from Boston. I saw the Coldplay concert where that couple was outed.
Oh my gosh, you were there.
I was there. It was very historic. I cannot believe I was in the audience with 55,000 people. It was close to the end of the show, and when it popped up on the screen, everybody collectively kind of went, did that just happen?
You saw
Wow,
them on the jumbo
that's not
screen.
going to be fun for them tomorrow.
Oh, okay.
It was not.
Yeah.
Yeah.
Wow. So Coldplay.
Yes. Yeah. Coldplay. I mean, I love so many different genres. It's really hard to say. That cover tune that I was talking about that I'm going to do tonight is because I've been listening to this hip hop artist called Gims, Gims. He does a duet with Sting, which I love, and it's called Rest, Reste, which in French means stay.
Yes.
So that is the cover tune that I will be
great.
doing. Yeah.
Yeah, I saw Sting
nice.
a couple of years ago in Moncton.
I saw him in Bangor.
Oh, did you?
Yeah.
Just was that recently? Or?
No.
A little while ago.
Yeah.
Yeah.
Yes.
Yeah.
Probably part of their like same tour, maybe.
Yeah. He still plays his old bass. He's still very
No
good,
way.
right? Yeah, he's very
Wow.
good.
I would like to see him again.
Yeah.
I would.
Yeah.
Anyway.
We have a lot of local artists here.
Yeah,
If you're
we do.
talking about people in your playlist, so Tortoise the Hare and the Millionaire, Les Chanterelles. I
Yeah.
love Les Chanterelles here in Fredericton. They're like a folksy sounding trio. In fact, one of them works for Public Health. I forget her name.
Oh,
Yeah,
cool.
yeah, and there's lots of great artists here in this province.
Yeah.
Nice.
Yeah.
So I know that you will have had a show by the time this airs, but are there any more upcoming shows that we should know about?
As of right now, no. I normally do the show that I do for Liberty Lane is usually an annual event, and that's usually at the Delta. So I just had that event in April. So normally
That's like a fundraiser too.
yes, yeah, that's a fundraiser. So as of right now, that's really the only tentative booking I have.
Okay, cool. Well, keep us posted, and then maybe we'll do like a live recording at your show or something.
Oh, I love that.
I'm setting us up for too big of a thing. Tim's looking at me. He's like, I don't know about that.
Here's what is it? Overpromise and underdeliver. Underdeliver. Overpromise. Underpromise. Overdeliver. There you go.
Exactly. All right. Well, I think that's a good place to stop right there, unless you
Okay.
have any more questions.
No.
But yeah, I think that's a good podcast length.
Thank you.
Yeah. Thank you so much.
Thank you
so
for
much
coming
fun.
in.
It was so much fun.
Oh,
Yeah.
All right. See y'all next week.
Bye-bye.
Take care.
Thank you for listening to Soundbite, a production of Porter O'Brien and CHSR 97.9 FM. Special thanks to our podcast host, CHSR, our sound editor, March Rojas Velasquez, as well as Adam Porter, who provided our theme music. You can find all our episodes on Spotify and Apple Podcasts under Soundbite, and you can follow us on Facebook, Blue Sky, and Twitter at SoundbiteNB, as well as LinkedIn under Soundbite Podcast.